Kia ora koutou, good afternoon everybody, thank you for being here. As has been indicated earlier, this morning we received information from the Ministry of Health about a person in the community who has tested positive for COVID-19 after they have left our managed isolation facilities. This afternoon I've been meeting with the Director General of Health, Dr. Bloomfiled, and a number of the other health officials to discuss the situation. Health's incident management team has been stood up and is now working on the case. The case is a 56-year-old woman who has recently been through isolation at the Pullman Hotel in Auckland after returning from Europe. She tested negative twice during her stay and was released following that. We don't yet know the origin or the strain of the infection. It's important not to speculate on that until we have that information. It's also too early to speculate on what our possible response options may be, including things like alert levels. We don't have the relevant information we need to make any further decisions on that. And as soon as we do, of course, we will keep people informed. Steps to detect or to do the genome sequencing and a second PCR test are underway. That can take around 24 hours for both of those to send the results back in, at which point we will share those and provide a further update. Until we get a clear picture, we're asking New Zealanders to do what they have been doing all the way along in our COVID-19 response. So I want to reiterate the key public health messages. Please, if you're feeling unwell and showing symptoms, please get a test and then isolate until you get the results of that test back. Don't go to work if you are feeling unwell. Please do use the COVID Tracer app to scan everywhere that you go. Turn on Bluetooth and wash your hands. Now I want to be clear here, turning on Bluetooth does not mean you should stop scanning. We want people to do both of those things. I also want to stress, because whenever we raise details about an individual's case here, there is a lot of public opinion on whether the person has done the right thing or the wrong thing. This woman concerned has been scrupulous in keeping a good record of her movements, scanning the QR codes everywhere she has gone. That's laid a very good foundation for our contact tracing team to do what they need to do now, and that work is well underway. So I want to acknowledge that. In a moment, Dr. Bloomfield's going to provide more information that we have on the individual case, the actions that the Ministry of Health and other health agencies are taking. I'll then give a few quick updates on the steps we're taking at the Pullman Hotel and with regard to people at the Pullman Hotel, and then we'll take your questions. So, Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. So as the Minister's just outlined, we are investigating this positive test result in the person who recently travelled back from overseas. In this case, the person had travelled in Spain and the Netherlands late last year. While in the Netherlands, she was with family members, all of whom were well at the time, but subsequently one or two of those family members have tested positive for COVID-19. The person travelled to New Zealand from London, stayed at an airport hotel there, en route to New Zealand via Singapore, and arrived in Auckland on the 30th of December. 14 days in management, as the Minister mentioned, in the Pullman Hotel, and while there returned 2 negative tests on the 2nd and 10th of January, and did not have symptoms while in managed isolation. After meeting requirements for release from managed isolation, she left on the 13th of January and returned home to Northland. She lives with one other person, and that person has not been symptomatic, but has been tested and is also isolating while awaiting results. Now, as part of our routine follow-up of everybody who's been in managed isolation, they are called 3 to 5 days after leaving, and this person was called on the 16th of January, I understand, and at that stage had reported no symptoms. On discussion with the Medical Officer of Health today, she noted that she started to develop very mild symptoms on about the 15th of January, and these got progressively worse over the period before she was tested. Now, those initial symptoms were just some muscle aches, and as you can imagine, in someone who's been through managed isolation, had 2 negative tests, she did not associate those mild symptoms with anything that could be COVID, but once she recognised that the symptoms were getting worse, she did the right thing and was tested at a community facility. She's been self-isolating since she took the test. The result came back late last evening as positive for COVID-19, and we are doing the further follow-up testing, which we routinely do just to confirm the result. The CT value suggests that it's a new case, but we are doing serology as well, just to rule out that this might be an historical case. We are also doing, as the Minister mentioned, the whole genome sequencing as quickly as possible to check what the type, the variant of the virus this could be, and indeed whether there's any link to other cases that were in the same managed isolation facility as this person at the same time she was there. We are working on the assumption that this is a positive case and that it is a more transmissible variant, either one of the one identified first in South Africa or the UK, or potentially Brazil, or another more transmissible variant. Given where we are in this global pandemic, the variants that are becoming more common are the ones that are more transmissible. After release from managed isolation, the person did travel around the southern part of the Northland region with her husband. Thorough interview has suggested just 4 close contacts, and those people are all being spoken with, isolated and tested. Interviews will determine if they too have close contacts, and those people will in turn be isolated and tested accordingly. In this case, we are also casting the net wide to ensure that we contain any potential community transmission. This is precautionary, but vital as part of our response. We need people to be vigilant and do the right thing. There is a number of locations, roughly 30, where the case has been in the 5 days or so after she left managed isolation in Northland. She was extremely assiduous in using the NZ COVID Tracer app to record QR codes, and this has meant we have been rapidly able to identify locations where she has been. Our team is in the process of contacting those places. As soon as we have contacted them, we will put information up on our website, and we will also send push notifications to people who had been there. I should also say I've just found out that the person had the Bluetooth functionality turned on her app, and so we'll be pushing notifications out through that separate functionality in the app as well. So we will publish the list of locations, potential exposure dates and times, and we're asking people who have been in those locations to stay at home and to call Healthline to find out the right time to get a test. Our advice is 5 days after they may have been potentially exposed. Healthline will be able to give information to anyone who has been at those locations and also where they can get tested. For those people who may have been in those locations who didn't use the COVID Tracer app, we need you to jog your memory. If you were in those locations at around the times you think are relevant, then please be precautionary, isolate and call Healthline about getting a test. As always, anyone who has health concerns can contact their GP or call Healthline for advice. I should say if anyone is symptomatic, either in Northland or elsewhere in New Zealand, the advice is to get a test, and we want people to still do that. And finally, we are standing up, or the DHB is standing up extra testing centres in Northland, including the southern part around Mangawhai, and details will be put online, and Healthline will have information about those additional testing centres and the timing for them. This is a reminder to all of us that the pandemic continues, that this is a tricky virus, and it behoves all of us to get with the program and do the things we all know need to be done to keep New Zealand safe. Wash your hands, scan in religiously, and stay unwell if you are home, and stay home if you are unwell, and get a test and isolate until you receive a negative result. Thank you, Minister.
Thank you, Dr. Bloomfield. The MB team who oversee our managed isolation facilities have also been swinging into action. They're currently reviewing the CCTV footage of the case's time at the Pullman Hotel and are contacting all of the returnees who stayed at the hotel and have left since the 1st of January, asking them to get a test and to isolate at home until they get a negative result I understand there are just over 600 people in that category. Staff are working at the hotel, staff who have been working at the hotel during that period are being tested regularly, but the team are checking to make sure that anybody who hasn't been tested in the last few days gets an up-to-date test as well. Happy to take your questions.
Whereabouts in Northland is the woman, and is she still there, or is she now in a quarantine?
She lives just south of Whangarei, and at the moment she is still there. And the area of Northland she has been travelling around is in that southern part, so Mangawhai and across sort of towards Dargaville, and as far south as Helensville is my understanding.
Will she be transferred to a quarantine facility, and when?
That will be up to the Medical Officer of Health. There may be an opportunity for her to isolate at home. I should say that having spoken to my counterpart, Carolyn Tremaine at MB, the staff there reported that this was a person who was extremely cooperative, compliant, and during her managed isolation period, and she herself reported being assiduous with distancing, use of masks, and infection prevention control, and she observed the same from others in the facility and from the staff as well.
Why didn't you name those 30 locations now, and why didn't you do it earlier today if you had the information?
We're still getting that information. As I said, we want to contact the people who own or run those premises before we provide that information. It will start to go up on our website at any time.
Well, why, when the public health imperative is a bit more important than some privacy imperative of telling an owner first?
Sure, the interview was done with this person just late this morning, and all the information was gleaned from that interview and from downloading the data from her COVID Tracer app. So we are going through a process, and our national contact tracing team is supporting the DHB to contact all those businesses as quickly as possible. Some of them aren't open today.
Are her symptoms still mild?
They actually got more, she became more unwell as time went by, but she doesn't need any, she's well enough to be at home. She doesn't need hospital level care.
Is the working assumption that it was contracted at a managed isolation facility, or is there a possibility that the incubation period was actually longer than 14 days? Are we starting to see with any of these new strains, for example, that the incubation period may be longer?
We're not ruling any possibility out or in at this point in time. We're acting as if it's a case, and we're doing all the things we need to do to prevent any onward transmission. The genome testing will help us, but one of the things we are following up, given the length of time, it's unlikely, it's possible, but unlikely to be a very long incubation period. So we are absolutely following up all her interactions within the managed isolation facility to make sure, or to identify if there was a possibility of transmission within the facility. That's obviously something we would want to know.
I was informed just before coming here too that the Netherlands, I think, has the third highest genome sequencing rate in the world, and so if there is a link there, we would hopefully be able to establish that using that information.
Were there people in the Pullman at the time?
Your mind forwards to Waitangi Day when many people from all around the country will be travelling to Northland, or at least?
It's still far too early to speculate on that yet. We will know a lot more in 24 hours than we know now. The genomic sequencing is a really big piece of the puzzle. As soon as we get that, that will tell us a lot more. Also more information about testing of contacts and so on.
Do you have contacted anyone there to start to work out plans or what?
Oh, look, it's very early days yet. I think, as the Director General has indicated, the person's movements tended to have been in the southern part of Northland, not up the top. But look, it's still far too early to speculate on anything to do with that.
So what have you done to prepare in terms of surge testing or surge contact tracing? I mean, how many are people on standby, or what's happening?
So two things there. Obviously today we've been working with the Public Health Unit in Northland and the Public Health Unit ARFs in Auckland, who are part of that, a single northern region response. We've been on the phone with them. We've shipped additional PPE and lab supplies up to Northland today. We're also sending a notice out to all public health units and DHBs to expect increased testing right around the motu, and that and putting our public health units on standby to support the effort in Northland. We can now do that through our national contact tracing system.
Have you tested her husband yet?
Yes. No result yet.
Yes, we're awaiting that.
People who tested positive in the Pullman during the time that she stayed there?
Yes, my understanding is it's 12 to 14.
13, so
13,
yes,
yeah.
between 12 and 14.
That's right. Yes, we've been sequencing all of the positive cases. So as soon as we get a genomic sequence for this case, we will be able to match it against any.
13, 14 who were in the Pullman, do we know what variant those people were?
I can say we know a number of them were the UK variant and the South African variant. So again, with that record of all those cases, the ones that were acute infection, remembering that we're seeing an increasing proportion of our positive tests in managed isolation are historical infections, and the whole genome sequencing doesn't work because there's just not enough viral RNA there. All the acute infections we will have a genome sequence on, and ESR can do an immediate match once they have done the sequencing.
You said this case travelled to Europe late last year. Did she leave New Zealand to go to Europe, or was she elsewhere in the world and then was in Europe and then came home?
I understand that she travelled from New Zealand to Europe and was travelling around for around 4 months in Spain. Actually, I think she was doing some work in Spain.
How much testing are we doing in the community at the moment, and what do you want to increase it by?
Well, we're seeing testing rates sort of hovering around that 3,000 to 4,000 per day on average. That's the overall testing numbers that we're seeing. Obviously, very happy to see those numbers going up. I think more than just though a blanket target around how many tests, it's more important to look at who is being tested. So obviously in Northland, where we send out push notifications, anybody who gets one, if they are showing symptoms in any way, then we want to make sure that they are getting tested. So we want to make sure the testing is, we're getting the right sort of surge of testing in the right places. But the overall public health message, as it has been for some time now, is if you are showing symptoms of COVID-19, regardless of where in the country you are, contact Healthline and seek out a test.
And will this case prompt you to review the speed of our vaccine rollout?
No, I mean, the biggest constraint around the speed of our vaccine rollout will be when we get vaccines into the country. Now, if you're following the international news, you will see those countries, even those countries that are well into their vaccine programs, are struggling with supply. They are, the vaccine manufacturers are struggling to keep up with demand. So we will vaccinate as soon as we can get vaccines into the country. And of course, we continue to look at all of the available options for that.
Which will come first, the vaccines arriving or the med-safe approval?
At this point, it's most likely, we'll have more to say on this over the course of the coming week, but at this point it's most likely that vaccine approval will come first, and then as soon as we're in a position to receive a shipment, we will do so, and we will get to vaccinating straight away. It is likely that, as we've always indicated, our shipments will be smaller in the beginning, and then they will increase in size as we go along. And so with those smaller shipments at the beginning, they will be heavily prioritised, and they will go towards those at-risk workforces and their family contacts. So our border workers and the people they go home to every night.
Have you contacted the people who are on the same flight that she was, or have they already covered within that Pullman kind of 600 person net?
Yes, so of course anyone who was on the same flight will have been in managed isolation, some in the Pullman and elsewhere. So as the Minister said, just over 600 people from a range of places were in the Pullman at the time that she was there, so at the same time. Also routinely, every time a case is identified in any managed isolation facility, the relevant airline is notified, because obviously we want to make sure that any crew, either New Zealand based or crew based elsewhere with other airlines, are notified and appropriate testing happens for them.
In terms of the timeline for where she moved around in those 5 days, it sounds like she's got 4 close contacts, but visited a lot of premises.
Yes.
With the 4 close contacts, are they family members? And the premises involved, can you give a sense of what we're talking about? Are any of the places that she went to places where many others would be congregating, and which were the most unsafe? Can you give us a sense of that?
So I'll give you a sense of that. So yes, the 4 close contacts, her household contact, and a couple of other people that in a retail setting she had more close interaction with. The other settings include cafes, restaurants, tourist attraction, a couple of Airbnbs, with very fleeting interaction with either staff and or other people there. It includes some retail outlets as well. The thing we've started doing differently recently, and we're going to again up that further this time, is rather than just calling people who were there at the same time casual contacts, we're assuming that they are all what we might call casual plus. So everybody who was at any of these settings, regardless of whether there's evidence they may have had interaction, we're advising to isolate, ring Healthline about getting a test and get that test and wait for a negative result until before they leave isolation.
Is that standard policy from now on? Is that what you're saying? You'll be doing for all potential cases?
Yes, that's what we've decided to do. We were already more or less doing that with the more recent cases in Auckland, where we had those incursions. But it's just an extra step we're taking because of these more transmissible variants now being around.
So if she caught it, say, a couple of days after her last test and before she left, when would she? Do you think she would have been the most infectious?
Well, what we do tend to say is that people, or we contact trace for the period 48 hours before someone became symptomatic. Now, the 48 hours before her very first mild symptoms actually coincides with her being in managed isolation. So really we're looking at that whole period once she left managed isolation, and we are also retesting everybody who was in managed isolation at the same time this person was, and retesting all the staff.
Can you just clarify those 30 locations, and because well, are you not going to put them up until you have actually notified all of the 30? Are you going to put them up in one lot or not?
No, we will put them up as the business is notified and we have the times and dates confirmed, which we do already. We will be putting that up, and as soon as we have notified the business, we will keep adding that information to our website. So I'd be very grateful if you could assist us in getting that information out to the public. So we will, as it's confirmed, we will drip feed it and update our website.
I want to reiterate that we will be issuing push notifications as well using the COVID Tracer app. So people who have scanned in to the same location at the same or at around that time will receive a notification directly.
But it's the people who haven't scanned who are going to be just as vulnerable, aren't they? Wouldn't it be better to just put the 30 locations up at the same time to have maximum eyeballs on what those locations are?
We'll be pushing them out through a range of channels. We do have an obligation to notify the business. They have staff to think about and so on, so we do that. The team are onto that at the moment, and they already have been able to contact some, so we'll start to get that information up as quickly as possible.
You said you're working on the assumption that it is one of these more transmissible, possibly more dangerous strains. Does that change next steps? Are we more likely to see restrictions and lockdowns if there's spread?
Look, I think let's get a bit more information before we start to make final decisions on any of that, but I'll ask the Director General. I mean, ultimately, we've always, as we have always done, lean heavily on the Director General's advice on these matters.
So, as I described just before, one of the things we are doing, and you saw New South Wales do this with their recent community cases, just identify locations and they say anyone who has been there, we're not determining whether they had interaction with the person, anyone who's been there, isolate, be tested and wait for the result. So that's one thing we are doing. Very much a hotspot approach, and then what we need to do more widely very much depends on what New Zealanders do next, and part of that is about people making sure they are getting tested if they've been in those locations, anyone with symptoms being tested, and we'll be giving advice. I'm meeting after this with the National Response Leadership Team, so we will have a look at what the picture is telling us. Once we have the whole genome sequencing and the results of other tests, including the person's household contact, that will help inform our advice too.
Mangawhai is a big holiday centre for people. Are you concerned that people might have now traipsed something back into Auckland or something like that? And did she go to any, what you would call mass gatherings like concerts or anything?
I can say no, she didn't to the latter question, and just to put this in context, the reason that she and her husband was travelling around Auckland was to spend some time together because she had been overseas for 4 months. So they weren't meeting with friends, they weren't attending mass gatherings or large events. They were just spending that time together.
Has there been a formal review of COVID-19 response and whether that is still appropriate or if anything needs to change in light of the more transmissible strains?
we've been reviewing all of our settings as a result of the more transmissible and the new variants that we're seeing globally, and you'll see that we've already made several changes, including the introduction of day 0/1 testing for all new arrivals into the country, pre-departure testing for all those who are travelling long haul, i.e. from countries other than Australia or most of the Pacific. We are now having pre-departure testing for them. We're always looking at our infection prevention and control in our managed isolation facilities, and you will know that towards the end of last year we made some changes around what type of PPE is used in those facilities, N95 masks being more widely deployed. So we are always reviewing and always looking for things that we can do better. International developments and the latest science always informs those decisions.
So
will
you're
you
happy?
look to reducing it down to 1,000 per week like Queensland have?
Sorry, what was that?
Will you look to reducing entries down to 1,000 per week like Queensland have? Same size population?
The numbers that we're bringing into New Zealand at the moment are what we can manage safely through our managed isolation facilities. We sit at around 4,500 rooms at any given time in managed isolation, and that can be a different number of people depending on the nature of the people coming in. Sometimes it's families, sometimes it's just single people. Single people obviously brings down the overall number of people. But we look very closely at that. There is still a long wait list of people trying to get back into the country. Some people have been away from their family for a long time. Some people do have quite a pressing need to get home to New Zealand. And so we're doing our best to allow them safe passage into the country and not unduly restrict that, whilst also making sure that we're as safe as possible in doing that.
Minister, on the vaccine timeline, with this talk of these delays kind of overseas, are you still confident that April will you be able to give vaccines to some people in April as kind of originally planned?
Look, as soon as we get vaccines in the country, we'll be looking to get them out there. Our pre-purchase agreement for the Pfizer vaccine has our first shipment arriving in the first quarter, i.e. by the end of March. If we can get other shipments through our COVAX facility, which is what we're working on, to get some vaccines into the country earlier than that, then of course we will do that. So, but you will see from other countries, those other countries that have been looking to speed up their program, the biggest impediment that they're experiencing is that they can't get the vaccines. We've always been very clear that we don't want to overpromise in that area. We know that vaccine supply is going to be our biggest constraint, at least in the early part of this campaign, our vaccination campaign, and therefore, I wasn't going to stand up and say that we'd speed things up if I wasn't confident that we could do that.
How many doses, just remind me, are in that first shipment?
We're expecting around 200,000 doses in the first shipment, and then another shipment fairly shortly thereafter. That's based on the pre-purchase agreement. Obviously, if we can get anything else particularly through COVAX, then that'll really depend on those international negotiations that happens around that.
Is each dose a full course, or is that only one?
No, that's one dose, and obviously people need 2 doses. So we've got about 1.5 million doses of the Pfizer vaccine coming over the next period of time, but as I've said, it will become in instalments. Ultimately, though, having both doses arrive at the same time doesn't speed up the program in any way.
Are you aware of whether this woman travelled in any way by public transport, or was it always a private vehicle?
I couldn't, hand on heart, say, but my understanding is from the nature of the trip she was doing, it was just her and her husband travelling by private
Go
vehicle.
anywhere in Whangarei?
Oh, almost certainly, yes. And that will be, but when we send out the notifications and list the premises she's been, then people will know.
Okay, we'll take the last few questions. Yeah.
Apologies if this has already been asked. Do you know what the scanning data has been like in Northland in particular over the last couple of months? Have people been vigilant?
No, I don't have a regional breakdown of the scanning data, and I'm not sure. I think we've been through this once before, and I don't think we can get that kind of regional level of information. But I'll certainly go back and check and see if we can get a bit of a more regional breakdown. I know in terms of the testing numbers, I think it was we were sitting at around 800 over the last fortnight in Northland for COVID-19 tests. I'll just double check that. I don't want to add any zeros or any numbers onto that. It was. Northland, where are we? Yeah, just under 800 tests in Northland over the last fortnight.
There needs to be an additional test for people who have left quarantine in isolation hotels once they're home.
We have explored that, and we did get some advice on that. And the advice, and this was late last year, and the advice that we had was that that wouldn't be justified. That our day 3 and day 12, testing regime in 14 days of managed isolation is still seen internationally as the gold standard in terms of stopping COVID-19 coming into the country. But again, I'll invite the Director General to comment on that.
Yes, that's the current advice, and also recalling we do also have the day 01 testing now, and also we do a day 6 or 7 test on people who may have been on a flight with, or be a contact of someone who is found to be a case early on during their stay. So at the moment, what we do when everyone leaves is we do that follow-up call to make sure that people are not symptomatic and that they know what to do if they do develop symptoms.
We are hearing reports already of a run on supermarkets. Clearly some Kiwis are preparing for a lockdown. What do you say to them?
Look, that's so premature. At this point, in these early phases of any investigation like this, we've just got to assemble all of the relevant information. There is absolutely no need to panic about anything. And I just would point out to everybody, and I'm not in any way foreshadowing that there would be any alert level changes, that where that has happened in the past, our supermarkets have managed to restock quickly. You can still go to the supermarket in the event that any restrictions are put in place. So there is absolutely no need for any panic buying or any of that kind of behaviour. All right, thank you everybody.